Cerebral palsy and its definitions, deficits, and adaptations for para-alpine skiing. Cerebral palsy, also known as CP, is a group of disorders that affect movements in parts of the body. The brain's cerebrum regulates motor function, and when damaged, paralysis of voluntary movement occurs in certain parts of the body. There are 4 types of CP depending on which area of the brain receives injury. However, they all result in deficits to movement of the body. The 4 types include spastic, ataxic, dyskinetic, and mixed. Common physical symptoms in people with CP include contractures, floppy muscle tone, gastrointestinal problems, incontinence, lack of coordination and balance, and spasticity. Common neurological symptoms include behavioral problems, delayed motor skill development, difficulty with speech, and sensory impairments. Spastic CP is the most common type, affecting about 80% of people with the disorder. This results from damage to the cerebral cortex and causes hemiplegia, muscle tightness, and jerky movements on one side of the body. Ataxic CP is caused by damage to the cerebellum, resulting in poor posture, balance, and motor learning. Dyskinetic CP is caused by damage to the basal ganglia, resulting in difficulties controlling movements. This may cause involuntary twitching. Mixed CP occurs when multiple areas of the brain are damaged, causing symptoms from each type to be present. Associative conditions of cerebral palsy include intellectual disabilities, hearing loss, epilepsy, and sensory processing problems. Intellectual disabilities are present in 66% of cases, and this is because widespread damage to the brain can lead to a plethora of intellectual disabilities. Hearing loss occurs in 20% of cases because damage can occur to the nerve receptors in the inner ear. Epilepsy occurs in 50% of cases because an injury to the brain can increase the chance of a seizure occurring. In these cases, a participant would be required to wear a seizure harness during the ski lesson for chairlift safety. Sensory processing problems occur in 90% of cases because damage occurs in the area of the brain responsible for processing sensory information. Adaptive equipment allows each participant to ski down the mountain as someone without a disability would. Starting in the top row, going from left to right, is the adaptive equipment frequently used for participants with CP. This includes first a slider, which is a walker with skis attached. This is a great device because each element can be adjusted to fit the participant's spasticity patterns. A snow-go, similar to a ski bike except you stand and hold on to the handles. A ski bike, the participant sits and can either put their feet on the pegs or on ski blades. A bi-ski, which is a sit ski with 2 skis attached. A mono-ski, a sit ski with 1 ski attached. And handheld outriggers, which can be used for sit skiing or when they're lengthened for 3-tracking and 4-tracking. Many participants decide to 4-track and use the handheld outriggers similarly to crutches. Sit skis and ski bikes can be an option for participants with more severe deficits, and participants who can stand ski can use 4-tracking equipment to keep balance and preserve energy. Many people with CP use assistive devices to help with ambulation such as crutches, walkers, canes, and orthotics. When downhill skiing, participants can use a plethora of equipment depending on their needs. If a participant with CP is stand skiing without adaptive equipment, it is important to check on their energy levels as they do fatigue quickly. People with CP are a fall risk due to their instability and decreased muscle control, so using assistive devices like a pole, hula hoop, or wheel can preserve energy. A tip connector, or edgy wedgie, can also be helpful for participants with spastic tone who have difficult time putting their skis in the correct position. A seizure harness is used for participants with an associative condition of epilepsy to attach them to the chairlift. When fitting a participant into ski boots, it is important to recognize that many people with CP wear ankle-foot orthoses. These support the lower extremities when walking despite their motor impairment, and they're pictured on the left. Participants can choose whether they would like to take them off and put a regular ski boot on, pictured on the top, or keep them on and wear a snowboard boot, pictured on the bottom. If they prefer to wear a ski boot but cannot fit their foot into a regular boot, a rear entry boot, pictured in the middle, can be used. This boot opens wider for easier foot and ankle access. There are several benefits in skiing for people with CP. Skiing can improve standing balance, skiing can improve strength and gross motor control, and participants are given a sense of freedom. There are also several risks that come with skiing for people with CP. Their fall risk is increased. There is a risk of staff and the participant sustaining an injury from falling while using a piece of heavy adaptive equipment, and there is a risk of sustaining an injury due to aggravating muscle atrophy.